Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. I am back today with another one of the ABCs of concussion, moving on to letter H. Again, as with previous episodes here in the ABCs of concussion, I'm covering all of the words that I can think of that cover each letter as we go along, of things that are related to concussion and TBI. Again, concussion is a form of TBI, so as we talk about those things, I'll use those terms interchangeably. But if you are somebody who has some of these symptoms and you've never really understood why, think back to when those symptoms started and see if maybe you had some kind of incident prior to those symptoms starting that might have led to a concussion. Again, you don't have to lose consciousness. You don't actually have to hit your head. So even if you hit your torso hard enough, maybe you slipped and fell on the ice, you didn't hit your head, but it jostled your brain around enough inside your skull that maybe you did end up with a concussion from that and just didn't have the answer until now. Or maybe you're somebody that knew you had a concussion, but you still have these symptoms and you can't figure out why. Maybe nobody really explained them to you before. I've learned throughout this whole process of my own recovery that there's a lot of things that people didn't tell me that were there and that I didn't know of until I was learning as now being a survivor. So as we get into this letter today, letter H, all of these topics, again, we'll start with the letter H. And if you feel something or hear something that resonates with you, feel free to let me know. Reach out on any of the social medias, leave me a comment on the show. Any of that is possible there as well, too. So, and if you have something you'd like me to cover in future episodes, again, same thing, reach out on social media or leave me a comment in the show so that I know to include a word if you have one of those for me. So the first letter for today, the first word in the letter H is headaches. This is probably one of the most common complaints after somebody's had a head injury is the post-concussive headaches, which these are no joke, people. Post-concussive headaches, not a joke. They are the real deal with headaches. And these are not necessarily the same thing as migraines. So that said, somebody that had migraines follow or previous to their head injury might have more headaches afterwards, or they might have a decrease in their migraines. In 2 years, I've actually not had a migraine. I'm stuck with these post-concussive headaches, but I've not had a migraine. And we'll talk about what that means in just a minute here. That said, I do know plenty of people who have had an increase in their migraines since having their head injury. So first off, I want to talk about what the difference is between migraines and other types of headaches. So a migraine, by definition, is pain typically on one side of the head. We call that unilateral head pain, can be left or right. It's throbbing in nature, almost like you can feel every pulsation of your blood. You may have sensitivity to light, sound, or smells. There might be nausea or vomiting included. So those are kind of the typical symptoms that we talk about when somebody has a migraine. So not every severe headache is a migraine. Not every migraine causes pain. You may have all of those other symptoms. You just don't have the head pain with it. So we call that an acephalgic migraine, meaning you don't have head pain. But the migraine itself is just the constriction of the blood vessels causing the symptoms, not necessarily the headache itself. Whereas a tension headache tends to be more constant or dull in pressure, feels like just pressure in the head or a tightness across the forehead, around the sides of the head, maybe around the back of the head and the neck. Sometimes feels like a rubber band is wrapped around your head. That's the definition of a tension type headache. You can have migraines and tension type headaches, but they are very different. And the tension type tends to be more of what we see as those post-concussive headaches. But I will say that it's not a dull pressure when I get mine. It feels like literally my skull is going to explode because there's too much pressure inside of my skull. So now you know a little bit more about me if I haven't mentioned that one before. So those headaches are very different. They respond very differently. Post-concussive headaches don't respond to your typical migraine treatment. So all those abortive medications that we have for migraines typically don't work to stop the post-concussive headaches, unfortunately. Something that is the same, however, is triggers. Something that can trigger a migraine can also trigger post-concussive headaches. Lack of sleep or poor sleep being probably one of the biggest ones. Strong smells, stress, anxiety, anytime you skip a meal. So with concussion, it's common to forget a meal or miss a meal, or you don't have the appetite to eat. Skipped meals can cause headaches of any type. Dehydration, if you're not drinking enough water, that puts you at increased risk of having headaches, again, of any type. And with water, I know we've talked about this on the show before. Take your body weight in pounds, divide that by 2. That's the number of ounces you should drink at baseline. If you're exercising, if you're doing any kind of increased activity, if you're in an area where it's very humid, you sweat a lot, you're going to need more than that. And while your brain is healing, you're also going to need some extra as well. And then cognitive or physical exertion. If you exert yourself, you have to think a lot, you have to do a lot of movement. Either of those can cause headaches, also be triggers for that. How long will post-concussive headaches last? I wish I had a crystal ball for that. In the research, it often says that most of these headaches will resolve within 3 to 6 months, but I think we know by now that research isn't always accurate. I'm 2 years out from my accident. I still get post-concussive headaches. So there are factors that make them more likely to continue. They're more likely to last longer if you had headaches prior to your head injury. They are more likely to stick around if stress is not managed. Stress being one of those, again, big triggers for headaches. If you're not dealing with the stress, which stress is going to be there after a head injury, if you're not dealing with it very well, not managing it well, you're typically going to have headaches that last a little bit longer. Headaches, these post-concussive headaches are often also related to neck injuries. So neck issues after that injury can lead to a lot of headaches as well. So that also might be a thing that you need to investigate and manage and treat. In general, management for these post-concussive headaches, a lot of it is going to be lifestyle. So making sure that you eat healthy meals, that you stay really well hydrated, that you exercise or do some kind of physical activity as much as possible. Again, you don't want to overdo it, but that light exercise, as we talked about back in letter E, is still very important. Again, managing stress and getting regular sleep. Another thing that's really difficult to do, but that regular sleep will in general help your brain heal better. It also decreases that risk for those headaches. Relaxation is really, really important, especially for post-concussive headaches, again, because stress is such a big factor. So things like deep breathing, progressive muscle relaxation, guided imagery, biofeedback, mindfulness, these aren't things that I just say, oh, well, just do these things and you'll be fine. These things over time can help manage your stress. And things like deep breathing can actually activate your vagus nerve, which we'll talk about a little bit more later on here as well. So also really, really good things. And there's a really good reason why we recommend doing these things. Neck exercises. Obviously, if neck injury is an issue, neck exercises to strengthen those neck muscles will help to decrease headaches as well. Things like massage and manipulation, either with a physical therapy, a chiropractor, or a DO, doctor of osteopathic medicine, that practices the osteopathic manipulative movements, OMM. If they're doing those kind of movements, that's also going to help decrease some of those headaches and the neck issues. Acupuncture, neuromodulation, also helpful for headaches, and neuromodulation can be done via multiple different ways of treatment. Nerve stimulation, I have a dolphin neurostimulator that also can help with neuromodulation, and there are in-office treatments like microcurrent treatments that can be very helpful as well for neck pain and headaches afterwards. Abortive treatments for post-concussive headaches. Again, the migraine abortive treatments are not going to work. Abortive meaning you're stopping that headache from happening or you're decreasing the severity of it. Things like ibuprofen, aspirin, acetaminophen, those anti-inflammatory medications will help to decrease it a little bit, but you have to be careful. You don't want to overuse them. Just because they're over the counter does not mean you can take them however you want them. If you're taking these medications on a daily basis, you're going to end up with either what we call headache, medication overuse headache, or rebound headaches, whichever terminology you are more familiar with. But that can happen if you are taking these over-the-counter medications on a daily basis. So really, ideally, you shouldn't use it more than a couple times a week so that you don't have those overuse headaches that come on. And then preventive treatments. This is where sometimes it can be similar to the migraines. So preventive medication can be useful to prevent those headaches if you're having them very, very regularly. it doesn't necessarily treat the cause, but it treats the symptoms. So it's the same preventive medications that we use for migraine often. There are three main categories of those: beta blockers, anti-seizure medications, antidepressants. They're typically at different doses than we use for the original cause. So even though that might be what it says on the bottle, that's not the purpose that we give them to you for. We give them to prevent those headaches from even happening. And your provider will assess which of those will be most beneficial for you. For example, if you're at higher risk for seizure, we try to kill two birds with one stone and give you a seizure medicine that will also help to prevent your headaches. If you have a lot of anxiety, depression following your head injury, you might be better served by taking an antidepressant that also treats the headaches then too. So that's where you have to have that really good conversation with your provider to figure out which one of those medications might be best for you. Personally, I like to start with simple things like vitamins and minerals, magnesium, vitamin D, and the B vitamins are usually really, really helpful for trying to curb some of those headaches. And sometimes that's all you need is those vitamins, and the prescription ones aren't necessarily necessary. Yes, I just use those back to back. The next H word, not trying to poo-poo headaches, but there's so much more that I could talk about that probably could take an episode by itself. Those are kind of my highlights for that one. So the next H word is hygiene. And this one is a little bit different because it's not something that people often think of. It often takes kind of a backseat when you are recovering from a head injury because you might forget to take showers. You might lack the motivation to get in the shower. You might not remember the steps included in taking a shower. There's a lot of thought process that goes behind that we don't really often think about. So it's really, really important. If there are physical limitations, you might need assistance of another person or devices. There are shower chairs if you can't stand up. There are bars and railings that can be added to your shower or your tub to help you get in and out if you have physical limitations because of your injury as well. If you have any lacerations because of the injury that you had, you do also need to be cautious of cleaning those carefully and gently. If you're at risk for seizures, so say you had a head injury that involved blood on your brain and you are now at risk for seizures, it's not recommended to take baths alone, at least initially, while you're trying to get your medications all settled out, because you don't want to potentially have an unwanted event happen while you're in the bathtub. You might want to take a shower, especially when somebody else is home, so that you have that person in case something happens while you're in there. Next topic. Some of these I'm going to go through kind of quickly. Some of them I'm going to cover a little bit more in depth. But the next one is hemorrhage. And again, I just wanted to bring up the word to let you know that yes, it's still in the alphabet. We did talk about this pretty well in depth back in B for brain bleed, but I did want to bring it up again just for the terminology part of it. So a brain hemorrhage, a brain bleed, they're all the same things. You had blood onto your brain. And that's one area where when I used to work in the hospital and we would get consulted from neurosurgical patients that had fallen and they had a traumatic brain injury that way, they had a traumatic bleed, they would call it. They wouldn't always necessarily tell the patients that they had a traumatic brain injury from it. They'd call it a traumatic hemorrhage or a traumatic bleed, but they wouldn't use the term brain injury. And then I would get consulted, or our team would get consulted, because the patient had neurological symptoms and they couldn't quite figure out why. Well, it's because when you hit your head hard enough to cause a bleed, you also hit your head hard enough to give yourself a concussion or a TBI. So they were having symptoms because they had the TBI and it just wasn't really well addressed at that point. So hemorrhage, just another term for that brain bleed. And the hemorrhage is why we get brain imaging most often. So we're looking to determine if there was a bleed into the brain. That might dictate different treatments, such as seizure medicine, because blood is very irritating on the brain, and that puts a person at higher risk for having seizures. So it might kind of change our plan of care a little bit and how we treat the patient. So it's really important to get that imaging to rule out a hemorrhage. Ruling out a hemorrhage does not mean we rule out a brain injury. It just means we rule out a hemorrhage. So that's it for that one. Again, if you want to remember more of it, go back to the letter B for the bleed. Humor is my next H word. And I recently had on my new friend Mimi Hayes onto the show. We talked about how her brain bleed experience led to her becoming a comedian. So she'd kind of thought about it before, but this definitely brought it about. Humor can change after a concussion, as we talked about in that episode as well. Some people have a decreased ability to understand or appreciate humor after their brain injuries. Others might laugh without explanations. That little thing we call pseudobulbar affect, or something that looks like pseudobulbar affect, when somebody can laugh when they should be crying or cry when they should be laughing. Those emotional outbursts that are not, really well understood very well by a lot of people. Some people use humor as a coping mechanism, and we will joke sometimes inappropriately as they try to come to terms with something traumatic in their life. Just because people make jokes about things doesn't mean they're okay with those things either. So sometimes it's more socially acceptable to joke about things than to have serious conversations. And that's probably a whole nother topic by itself. But as we joke about these things, it doesn't mean that you're okay. It doesn't mean that you've recovered from it, as we talked about with Mimi on this show. It just means that you're trying to joke about things because it takes your mind off of how serious it is sometimes, and sometimes you're just trying to make light of the situation a little bit. That said, humor can be a very important part of your recovery. It's a really good form of stress relief. And one thing that I shared in my interview with Mimi was that I laugh harder now sometimes. So I have this really goofy laugh that comes out when I laugh really hard. It has been present much more often since my injury than it was previous to it. It first came out, I don't know, probably like 20 years ago, but it was so few and far between that most of my friends had never heard it. So now, since the accident, my kids joke that we hear it all the time. So it's just there. So there's that. So humor can be very useful, but it also can be kind of a coping mechanism. Depends on how you use it, whether or not you're using it therapeutically or not, I guess. So that is yet to be determined. Hydration is the next topic I wanted to talk about. Again, hydration, as we talked about with the headache, hydration is very, very important. We are not all great at it, even without a head injury. But after a head injury, it's easy to forget to drink. It's easier to forget whether or not you have had something to drink. And you might dislike the taste of water. So sometimes our tastes change after a head injury. So you might not even like the taste of water. You might have a hard time keeping it down. So sometimes you need to add some different flavors to that. And we'll talk about that in just a second here. But again, that take your body weight and divide it by 2. That's how you get the amount of ounces of water you should drink every day. Again, that's your baseline. If you drink a lot of coffee or caffeine, I forgot to mention that part, you also need to increase this. So to give you an example, if a person weighs 150 pounds, 150, you divide that by 2, you get 75. That's 75 ounces of water, or approximately 2 liters of water, that you need to drink at your baseline every day just to maintain your hydration. What counts for hydration? Things like, other than water, would be herbal teas, broth, anything that's clear at room temperature, except for sodas like 7-Up, Sprite. Those do not count as water. Sodas are actually more dehydrating. Coffee is dehydrating. Decaf coffee, possibly okay. But herbal tea is much more better. Much more better. Ooh, that was really bad grammar. Sorry about that. Um, Water, herbal teas, broth, again, something that's clear at room temperature would be okay with them. What doesn't count? Things like milk, caffeinated beverages, soda, alcohol, any of those are more dehydrating than they are hydrating. So if you have those things, you also need to have a glass of water to offset it. So I used to talk to patients all the time about caffeine intake. For every glass of coffee they really should have a glass of water to offset the dehydrating effects of the caffeine of the coffee. The other thing I would say with that is that try not to drink a ton of water after dinner, because then you'll need to get up and go to the bathroom, and you really need to get your sleep. So you don't want to be getting up all night long to go to the bathroom. So make sure that you kind of taper off a little bit after dinner so that you're not up all night using the restroom. The next bigger topic I want to talk about is something that we really haven't addressed in any of the alphabet letters so far, and that is hitting your wall. So hitting your wall, as I've talked about it, it's kind of literally hitting that figurative wall. So think about it, if you were to literally hit a wall, you literally cannot go any further, right? So if you're hitting this figurative wall, you run out of brain juice, essentially. There's only so much energy that you have to get through the day, only so much energy that you can expend with all of your different activities that are required. So once you meet that max, you can't go any further because you don't have the battery capacity to do so. So that's kind of how I use that term. You hit that wall because you cannot go any further. That's your pause button. You have to stop, you have to rest, you have to get away from that situation. So you only have so much energy, whether it's physical or cognitive, that you can expend at any given time. And your brain is using excess energy to try to heal. So, of all the energy that's created in your body, we talked about this back in A, we talked about it with E, we talked about it several times already from that perspective of the fact that it takes more energy to try to heal your brain, and you can only create so much in the day because your mitochondria, remember that little powerhouse in the cell, gets paralyzed essentially, so that you cannot create enough energy to keep up with that expenditure. So you often reach that limit where you've overdone it and you need to take a break. I call that hitting the wall, as I mentioned. So often this will lead to increased symptoms. You feel like you literally might sometimes feel like you had the injury all over again. And the recovery time will depend on whether or not you continue to push through your wall or if you have listened to your body at that point. So it may take hours, it might take a day or more to recover, or even longer than that, depending on how hard you've hit the wall, how hard you pushed through it. For example, when I first uh, noticed that I was hitting my wall, it would take me a couple hours of activity. That was it. That's all I could get through. So trying to go back to a full day of work was not a possibility. Trying to go out for dinner with friends, also not a possibility because it typically took more than an hour when you consider drive time to get there, the activity, and then driving home. So I often hit my wall as we were out at dinner with people. I have worked my way up, so it's a whole lot better. If you were watching my social media, you know that I ran a half marathon recently. And yes, that was a stretch. Should I have done it? Maybe not, because I'm still now recovering, and that was a couple weeks ago, almost here. So, yeah, the recovery time definitely takes a whole lot longer. I hit my wall at mile 12 out of the 13.1, and I'm still trying to recover from it 2 weeks later. So there is that. Should I push through again? That's debatable. But I did because I'm type A and I don't quit. So I don't necessarily say that I would recommend that for others. Uh, Hitting the wall often goes unnoticed by the person that's hitting it until after the wall is hit, usually. But it can be noticed by somebody else who is familiar with the individual. For example, my husband would notice that I hit the wall long before I did. Neither one of us really knew what was happening to begin with, but several months into my recovery, he saw me hit my wall. He saw the physical changes in my face, my demeanor, my entire appearance changed. Um, and I wouldn't even know that I was hitting my wall. So he could see it. He could see this change in me. He could see things happening and leading up to it. And it wasn't until my headache kicked in that I was aware that I was hitting my wall. And once I hit that wall, it was a point of no return. So whatever event we were at, I had to leave because I could not come back from that at that point. Recently, I noticed it in a friend when we were traveling together. So I saw her hitting her wall. She wasn't aware of it, but I helped her realize what she looks like. So she actually takes selfies now occasionally and she can see it because it shows up in the eyes. That change in the eyes is kind of the big thing. So she'll send me selfies every once in a while and she's like, there it is. It's in the eyes. Yep. So she didn't recognize it until I saw her hitting that wall. So it is important once you know that you are hitting that wall, it's really important for that individual with the head injury to try to identify the triggers that got you there and watch for some of those signs to watch for that you're leading up to it. And You might need to learn from others who have been able to identify when that wall has been hit. So when my husband started noticing it, again, it took me a really long time before I wouldn't even notice that I had hit my wall. But now I notice that I start getting really tired. I start yawning. I start getting fatigued even before my wall has been hit. I start to get agitated a little bit. So those are signs that I can try to acknowledge now. I still don't notice what's triggering it because as I try to heal and I try to push myself further to see, has that wall been moved a little bit? It will move. And then some days it'll move backward. So even though I feel like I've made some progress on these things, like after I ran that half marathon, I tried going out for another run this past week and I hit my wall at 5 miles. Like I went 12 a week and a half ago. Why is it 5 today? But there we are. Recovery is not linear. It's not a straightforward thing. 2 steps forward is still forward, but you might take a step backwards. Still 1 step forward, but it's not that process of it. You don't get to just keep continuing. There are times when you still have to fall back a little bit in order to keep going forward. So therefore, you have to think about what can you do before you get to that. So if you haven't identified your triggers, if you can't figure it out, if you're not sure where you are, this is one thing that my therapist, my physical therapist, occupational therapist, speech therapist were all telling me all along was that I needed to take breaks before I felt like I needed them. So take regular rest breaks, schedule them into whatever activities you're doing so that you take that rest break. Take breaks before you need them so that you don't hit that wall so hard. And some tricks that I've learned from my neurological chiropractor more recently is some little kind of functional things that you wouldn't normally think of. Again, typically this is outside the box thinking, right? Sipping on pomegranate juice. Sipping on pomegranate juice has vasodilatory effects. So vasodilation, it opens up your vessels. It keeps that autonomic nervous system from getting so crazy and going out of whack where you've got your blood pressure going up and down and all over the place. So it keeps it more steady so that you don't have those crash states where you do hit that wall. Using a wrist brace, just a compression brace on my wrist has been helpful for decreasing some of that autonomic stimulation as well. So again, the pomegranate juice, rich in antioxidants, it can combat the inflammation in the brain, which is part of that autonomic dysfunction. It has nitrates and polyphenols in it that can improve the blood flow and vasodilation, which also is impaired with autonomic dysfunction. And the wrist brace helps with similar blood flow issues there as well. So hitting that wall can be very serious. You do need to watch for those triggers, try to take breaks before you need them, and look for some of these other things that can help you along the way additionally. Also, kind of talking about that autonomic dysfunction part of it is the next H letter, HRV, which stands for heart rate variability. Heart rate variability, by definition, just means the variation in time between those heartbeats, that interval time between heartbeats, which is a measure of the autonomic nervous system activity. There are normal fluctuations of those time intervals between those heartbeats, and those normal fluctuations are measured in milliseconds. So these are tiny, tiny little fractions of time that we're talking about, these normal fluctuations happening in those heartbeats. Non-invasively, this can be measured to evaluate the autonomic nervous system. Non-invasive meaning we don't have to stick any lines or tubes or anything in you in order to measure this. It can be measured by things like EKG and wearable devices. The wearable devices would be like fitness trackers and smartwatches. So I have a Garmin watch now. There are multiple versions of that. The Aura Ring can do the similar kind of thing. I personally went to the Garmin watch because I needed a watch to track my other activities anyway, and it also tracks your sleep and it tracks the HRV, it tracks your stress level. There's so much that it can track, and you don't have to pay any extra monthly fees for it like some of those other wearable devices require. How do you interpret HRV? So HRV, this heart rate variability You want to have a lot of variability, meaning your body can compensate and it can adjust for whatever situation you have. So a high HRV means you are healthy and you have a resilient autonomic nervous system. It often correlates with, or does correlate with lower stress levels, better cardiovascular fitness. Again, it shows adaptability of your body. It shows that you can adapt to whatever situation comes at you, and your heart is not going to be staggering to try to keep up with whatever it is that you're doing. A low HRV, then on the flip side, low heart rate variability leads to imbalance in the autonomic nervous system. It is correlated with increased stress in the body, increased stress, higher risk of cardiovascular problems, because there's less flexibility for the body to react in the moment. So if something's coming at you, think about being in that constant fight or flight state. Your heart rate is always going to be elevated or off or something, and you just can't respond like you should. You should be able to get spooked by something and have your heart rate just come right back down again. But if you're in constant fight or flight, you get spooked by something, and all of a sudden you have that saber-toothed tiger that's chasing you down, and you're stuck in this fight or flight mode and you can't come down from it. So you don't have that good variability. It takes you way too long to recover from those events. After a concussion, individuals might often experience reduced heart rate variability, especially when they're symptomatic. Factors that will influence that include stress, sleep, and diet, meaning if you have a high stress, if you're not sleeping well, if you're having a poor diet, that's going to change your heart rate variability as well. Why does it happen after a concussion? I mean, it can happen after lots of different things, but why after a concussion? There is a physiological uncoupling of the autonomic nervous system and the cardiovascular systems. So normally they work together very closely, meaning if you have that jump in your autonomic nervous system, your heart rate goes up, it comes back down. Those two are paired quite a bit. And that the changes in the brain's ability to regulate the autonomic nervous system will lead to this inability to regulate that HRV, right? So all those different hormonal changes, the physiological changes after a concussion lead to this lower HRV. What is the significance of it? It's important because if you have a wearable device like this, if we can get those measurements of your heart rate variability, it can actually help us assess the severity of your concussion and monitor your recovery. And there's some research to show that it can potentially predict long-term outcomes after a concussion. So I would love it if we could get HRV monitors on everybody that has a concussion so we can see what this looks like, how it shows us that data over time, and how it's helping us to monitor that recovery. And I can tell you, as I've gotten better, as my autonomic nervous system has gotten better, I'm not hitting my wall quite as much as I used to. My HRV on my Garmin looks so much better. Like I would have a period of like 7 to 10 days every month that it was completely out of whack just a few months ago. And I'm 2 years into my recovery here. And I have had times now since that time when I've changed up my therapy protocol a little bit that I've had 2 months go by with normal HRV, like for real, first time in 2 years. I'm super excited about this. So definitely shows that recovery happening. And again, it's an exciting thing for me because I can physically watch myself get better because my HRV is improving. How can we improve HRV? Things like meditation and mindfulness. So those things actually work on decreasing that stress level over time. Again, decreased stress is correlated with higher HRV. So higher stress, lower HRV. Those things are very much counteractive on that. So psychologists can help manage stress, working with that with a therapist to manage that stress. Again, stress is going to be there. It doesn't just magically go away once you're recovering from a TBI, but managing that stress and trying to keep it down will help to increase that HRV. There are exercises that we can do to the vagus nerve. And I had another guest on recently. We talked about the vagus nerve in an upcoming episode here. The vagus nerve is important because it is one of the cranial nerves. It is the longest cranial nerve. It goes all the way down into your bowels. So when we talk about that vagus nerve, it hits so many different things in your body. It's not a peripheral nerve because it doesn't go out to your hands, feet, whatever, but it goes down throughout your entire torso. And that vagus nerve gets overstimulated just like the rest of your nervous system. But things that we can do to calm down that vagus nerve will help to bring down that overactive autonomic nervous system and bring up your heart rate variability. Things like cold water immersion. This can be in the form of a cold shower, cold plunges, doing a face plunge into an ice bath, ice packs on the back of your neck, your forehead, your cheeks, anywhere to try to calm your body down. Humming or singing actually helps to calm down that vagus nerve as well, because the vagus nerve also goes through your diaphragm and through your lung area. So humming and singing will vibrate that diaphragm, calming down the stress on the vagus nerve. Things like yoga, diaphragmatic breathing, massage, gargling, all of those things will help to calm down that vagus nerve, which again will calm down the autonomic nervous system. Vagal nerve stimulation works very similarly, except you're using a device to do those same exercises. And then regular exercise. Again, exercise is so important because it helps to get your cardiovascular fitness back where it should also. So again, don't overdo it. I may have overdone it with my half marathon, but don't overdo it. Don't do as I do as I say on this one. I usually practice what I preach. I apologize on that one, you guys. I just couldn't help myself. I really wanted to do it. But regular exercise, light exercise, listen to your body. Don't overdo it like I did. And then hormones, the last big thing. And then I've got a smaller one at the end. Hormones are another one that I learned about since my accident. I didn't know about this relationship between hormone regulation and brain injury until after I had my own injury. So hormone regulation can be disrupted by a brain injury. Up to 46% of patients will experience some sort of neuroendocrine dysfunction because of their brain injury. There has been a lot of research done at the Puget Sound VA system into this exact fact here, and proposing a multi-site clinical trial for hormone replacement for especially females who have gone through the VA system and have hormone dysfunction. The concussion can affect menstrual cycle in women that are still experiencing their menses. There was a JAMA article from back in 2017, which was the first that I could find that investigated menstrual patterns following a concussion. And in this particular study, it identified that 77% of the adolescent females that were in the study experienced abnormal menstrual cycles in their first 120 days following their concussion. So it was a very short-lived study, but it did show that a significant number of females will have disruption of their normal menstrual cycles after a concussion just because the hormones have been affected. Concussion can exacerbate the symptoms of perimenopause. Ivy Emery and Andrea Zimmerman were on here. We talked about menopause changes in the brain several episodes ago, and we just kind of briefly touched on this a little bit, but concussion can actually exacerbate the symptoms of perimenopause and can even lead to earlier onset of full menopause. So women can experience exacerbation of the symptoms of both menopause and post-concussive syndrome. So it makes both of them more difficult to deal with and more difficult to try to tease out which one is causing the problems. Is it post-concussive syndrome, or is it these hormonal changes that are actually leading to early menopause? The hormones that are affected are primarily because of the pituitary gland. So it can produce too much or too little of any of the hormones. And all of the hormones that come out of the pituitary gland include growth hormone, adrenal hormone, thyroid, sex hormones, and antidiuretic hormone. So if we see problems with the growth hormone specifically, that will look like fatigue in the person, altered cognition, changes in body composition. So changes in their weight can be because of growth hormone. Adrenal issues. So if we have changes in the adrenal hormone, we can see low cortisol levels. It can affect the stress response, and it leads to a lot of fatigue. If somebody has a thyroid, their thyroid being affected, again, it can look like fatigue, weight gain, and metabolic issues. If the sex hormones are affected, again, low estrogen in women, low testosterone in men, it can affect the menstrual cycles, as we've talked about. It can affect libido and sexual function. And then antidiuretic hormone, if that one is affected, it looks like excessive thirst and urination, such as with diabetes insipidus. So a lot of different things that can be affected, and we really just kind of are touching the tip of the iceberg on this one. I think this is an area where there's going to be a lot of research coming up. They're just really looking at it, like literally that study in 2017 was the first one to look at hormonal changes in those adolescent females. So what do you do if you're having some of these issues and you wonder if it is your hormones that are affected? If you think that any of these hormones sound like something that you're struggling with, it's really important for you to seek out an endocrinologist or a neuroendocrinologist for further evaluation, somebody to look at those hormones, check those hormone levels, and then potentially discuss hormone replacement therapy. And sometimes you need to replace multiple hormones, but it is important to follow a certain order, and your provider can help you figure out what that order is. So, lot of information here that we didn't previously know. And I have actually placed some referrals related to this because I know better, so I'm doing better now for my patients. And then to wrap up our H episode here, my last thing I want to talk about is hope, because maintaining hope in the face of TBI recovery is incredibly important. It is crucial in your survival. So again, recovery is not linear. There are a lot of setbacks as it comes to TBI recovery. Progress is always possible as long as you believe it is. So if you are stuck in a mentality where you say, well, this is what I am now and I'm stuck and I can't get any better, guess what? You're right, because you are what you believe. If you believe that you are stuck where you are stuck where you are. If you believe that you can still get better, you can still get better. It just means you have to look for other things potentially. Hope is a belief that there is a better future, and it inspires us to take action. You can't hope for something and then just sit and wait for something else to happen to you. Hope helps reduce depression and improve your overall mental health. It can be found in multiple ways. If you are a person of faith, having your faith can definitely increase your odds of being hopeful. It can be found in support groups, friends, fellow TBI survivors. So even if you're not in a support group, if you have a network of people that you can reach out to, and I have become very connected with a few other TBI recovery warriors, survivors, whatever you want to call us. And we check in with each other. And it's really important to do that, even if you're not in a support group, because you need the support of other people who have been there and understand, because they will be a big source of hope for you as well. And while hope can be very powerful, it is not a solution. It sparks you to find solutions. Again, it inspires us to take action, to look for other things, but hope in and of itself is not the only thing that will get you through this. But you have to have hope so that you continue looking for something to help you. And my last thing that I want to say on this is that there is no end date to recovery. So they used to say that whatever you got back at a year, 2 years, that was it. And that's where you were. And we know now that that is not the case. You can continue getting better. And as long as you continue looking for other options and trying new things, there is a possibility that you can continue to get better. The main thing that will be holding you back is your attitude, like I mentioned. So if you think there's no hope, you're right. If you think there is hope, you are also right. So the one thing that I've learned in all of this is that, again, there's no end date of it. And if you are stuck on a plateau, it means you need to seek out something that you haven't done yet. And maybe something that we talk about on one of these episodes of the ABCs will spark your interest in trying something new. Maybe you'll hear about something that you haven't tried before. Again, as I went through, I did the PT/OT thing, and then we needed to look outside the box, as my provider mentioned, and we did. And I started at Hypercharge and did photobiomodulation, the red light therapy, laser therapy, exercise with oxygen therapy, the nano-V, the PEMF mat, like all the things that we did at Hypercharge helped to spark my improvement so that I could continue working on getting better. And then I added the neurofeedback, the dolphin neurostimulator, the neurological chiropractor, all the other things that I was able to do helped me get off those next plateaus. There was not a one size fits all treatment. There are always lots of options. And as I'm starting up my concussion clinic, I am trying to give all of those options to the people that come through my doors because it takes a village to help someone recover from TBI. And again, it's not linear. There's a lot of moving parts involved, but there could be a lot of referrals to a lot of different places from all of the things that we talked about today and all the other episodes that we cover here in the ABCs of concussion. So once again, I thank you for being here. If you have questions, comments, concerns for future episodes, please reach out. Otherwise, we will see you next time. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.